Okay, hello, everyone. This is my podcast, Health Matters. Today is Tuesday, January the 17th. And today we're going to speak about hyperammonemia. Hyperammonemia. Hyperammonemia is when your ammonia levels within the body are elevated. Um, so it says it's a metabolic condition that happens when you have elevated levels of ammonia in your blood. Having high levels of ammonia in your blood is toxic to your central nervous system, which is the brain and spinal cords. Ammonia, also known as NH3, is a waste product that your kidneys make when they digest protein. So it says normally your liver then processes ammonia where it ultimately eliminated in a process known as the urea cycle. If there's an issue with any part of the urea cycle or your liver's ability to process ammonia, ammonia can build up in your blood, causing hyperammonemia. Hyperammonemia can be life threatening and requires immediate medical treatment. So, who does it affect? Ammonia. Elevated ammonia levels can affect newborn children as well as adults. 90% of hyperammonemia cases in adults are in people who have cirrhosis of the liver. Newborns can develop this due to congenital urea cycle disorders. Um, Children can develop this as well due to severe liver failure and inherited metabolic diseases. So it mentions that the commonality of this condition indicates that 1 in 250,000 births in the United States and 1 in 440,000 live births internationally. So what causes it? Several conditions causes hyperammonemia. The two main causes are liver issues and urea cycle disorders. So there are several conditions that causes this condition, the buildup of ammonia in the blood. We have liver disease, which is damage to the liver limits its ability to process ammonia. This often occurs or happens in severe liver disease, but you can have spikes in ammonia blood levels with a stable liver disease, especially when following a triggered event such as gastrointestinal bleeding or electrolyte imbalance. Liver disease is the most common cause of high ammonia levels in adults and children. Hepatic encephalopathy. This is a condition that happens when your liver is too diseased or damaged to properly process ammonia, leading to a buildup of ammonia in your blood that travels to your brain. It can cause confusion, disorientation, and coma. It can sometimes be fatal. Cirrhosis of the liver. Cirrhosis happens when scar tissue replaces healthy liver tissue. This stops your liver from working properly and causes hyperammonemia. Cirrhosis is a long term chronic liver disease. Acute liver failure. Acute liver failure happens when your liver suddenly isn't working well enough to perform its functions. Many different diseases and conditions can cause liver failure. Drug induced liver injury, for example, from acetaminophen, accounts for 50% of acute liver failure cases in the United States. Acute liver failure is responsible for 64% of the hyperammonemia cases in children. Decreased blood flow to your liver. If there's a lack of blood flow to your liver, your body can transfer ammonia to it to be processed. This causes ammonia to build up in your blood. Reye's syndrome, which is a rare condition that affects your blood, brain, and liver, that usually causes an increase in blood ammonia levels and a decrease in blood glucose. It mainly affects children and teenagers who are recovering from viral infections such as chickenpox, the flu, and have taken aspirin to manage their symptoms. The cause of Reyes syndrome is unknown, but because of the risk, children and teens should not take aspirin unless specifically recommended by their healthcare provider. So it goes a little further about urea cycle disorders that causes hyperammonemia. So the urea cycle is the process that is responsible for converting toxic ammonia into urea, which can be eliminated through your urine. The urea cycle involves multiple steps, each requiring a different enzyme. These enzymes include, it goes into the NAGS, CPS, OTC, ASSL, and ARGL. A deficiency in any of these enzymes results in the impaired function of your urea cycle, which leads to a buildup of ammonia in your blood. A deficiency of any of these enzymes is considered a urea cycle disorder, which results in acute and or chronic hyperammonemia. So, urea cycle disorders are congenital conditions. Newborns who have a complete deficiency in one of the urea cycle enzymes typically develop acute hyperammonemia within 24 to 72 hours of being born. So, in minor painful partial in a milder or partial urea cycle enzyme deficiencies, ammonia buildup may be triggered at almost any time of the life by illness or stress. So it says that these urea cycle disorders responsible for 23% of acute hyperammonemia cases in critical ill children. Other causes of hyperammonemia: kidney failure. If your kidneys are unable to effectively get rid of urea due to kidney failure, it leads to a buildup of ammonia in your blood. Certain blood disorders, multiple myeloma, and acute leukemia can cause hyperammonemia. Certain infections with urease producing organisms such as Proteus mirabilis, E. coli, and Klebsiella may cause severe hyperammonemia in children with congenital disorders of the urinary tract and older people with urinary tract infections leading to urinary retention. So, what are some of the symptoms of hyperammonemia? Well, they go from mild to more extreme, severe cases. And the more mild symptoms, you will have nausea and vomiting, abdominal pain, irritability, headaches, issues with balance, coordination and speech, behavioral changes. You also may show failure to thrive, decreased muscle tone, and neurodevelopmental delays. And those are affected by children. In the more severe cases of hyperammonemia, you may show confusion and disorientation, mood swings, excessive sleepiness, changes in consciousness, seizures, hyperventilation, and coma. So in order for it to be diagnosed, typically the doctor will have lab work done, and they will detect the number of ammonia levels within the blood. They also may do this by way of a urine test as well. Imaging tests can be done, such as a CT scan or a MRI. So the treatment for hyperammonemia depends partly on what's causing it. Liver disease or hepatic encephalopathy in adults, or urea cycle disorders in newborns. Treatment of acute hyperammonemia focuses on decreasing the level of ammonia and controlling specific complications, including brain swelling and pressure around the brain. For newborns with hyperammonemia, healthcare providers stop protein intake and provide calories by using glucose solutions. Healthcare providers also use hemodialysis, a procedure where a dialysis machine and a special filter called a artificial kidney clean your blood to remove ammonia from your newborn's blood. People who have a partial UCD enzyme deficiency that triggers hyperammonemia under stress are also treated by stopping protein intake and providing calories through glucose. Providers only use hemodialysis if the ammonia levels don't decrease after several hours of initial treatment. Medical treatment for hepatic encephalopathy involves decreasing the production of ammonia in your gut. The first line therapy for encephalopathy is an oral medication that includes lactulose and laxitol. These sugars decrease the production and absorption of ammonia in your intestines. Healthcare providers may also recommend the following dietary supplements to try to reduce the frequency of attacks in people with urea cycle disorders: L-carnitine, L-ornithine or L-aspartate, and arginine. So, how can hyperammonemia be prevented? Well, it includes avoiding or limiting alcohol, avoiding foods and drinks that contains trans fat and high fructose corn syrup, carefully managing your intake of prescription and over-the-counter medications to avoid liver damage, getting regular exercises, and limiting consumption of red meats. So the prognosis for hyperammonemia includes basically how high your ammonia levels are, how long you have had elevated ammonia levels, and the cause of the hyperammonemia. Again, the complications of hyperammonemia can be brain swelling, pressure around the brain, brain herniation, coma, and even death. So this is a very, very interesting topic to speak about. I don't want anybody to feel as though, okay, jump up and run to the doctor and say, okay, my ammonia levels are off key. No. Speak in confidence and in private to your primary care physician. I like to stress that this podcast, as well as this YouTube presentation, is for entertainment purposes. I am a licensed practical nurse. I'm not a doctor. I'm not a medical professional of any sort. This is not a ploy to get you to not see your primary care doctor and not to take whatever treatment options or regimens that has been given to you by your doctor. Okay? All right. So this concludes the podcast, as well as Facebook Live, not Facebook Live, I'm sorry, podcast, as well as my YouTube channel, Health Matters, speaking on high ammonia levels, which is hyperammonemia.